Hello, viewers and listeners, and welcome to today's COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Over the weekend, a team of government ministers and health officers visited Anabisi to provide medical care and assess the needs of migrants who entered Guyana from neighboring Venezuela.
On Saturday, when we went in as a team, we were able to do a quick appraisal. And at the time, while the reports were that there was severe malnutrition, what we found was that some of the children were chronically malnourished. I'm not too sure whether they have had prior medical attention, like things like vaccination and so forth. We also discovered that some of the children, they had severe skin rashes. Some of them had like upper respiratory infections, and quite a few of them had diarrheal diseases. Nothing as severe, but among these 50 children that we saw, 4 of them had some critical illness. Well, not critical, but we felt they were sick enough that for us to manage them properly, it would have been important to bring them to the hospital. So on Saturday, we brought 4 of those children to the Port Kaituma Hospital, where they're receiving additional treatment. Because it was getting late, we then sent a team back on Sunday morning, and that team spent most of the day at the site, and they were able to review about 25 more children, going through in more detail, checking them up and so forth. And of those 25, we found that some of them, again, similar illnesses, upper respiratory tract infections, diarrheal disease, some of them mild, and we had a number of children that had skin rashes, and of course the chronic malnutrition. So they were given treatment, and the medical staff that went in explained how to use things like ORS, if they're getting fever, what to use, how to use it, and so forth. We also, on Sunday, the team also saw 42 adults, and again, we saw similar types of illnesses among the adults, in addition to which we were able to detect among the group some cases of malaria. And again, they were given treatment based on the medical conditions that they had. What we found generally in the camp is that it's very unhygienic, because you have a lot of people living together.
198 persons from 25 families have settled in the area, located approximately 15 minutes from Port Kaituma.
Because of the unhygienic conditions, they're using the same water from the river, and they're using the river to wash and do other things there. So the water is not of good quality. So what we were able to do on Sunday, we gave them some what is called jerry cans that has filters in them. So when they take the water from the river, they can do some level of filtration, which would prevent some of which would help to purify the contaminated water, making it better for them to drink, and which would prevent some of the diarrheal disease that they're experiencing. So we have given them some equipment to do that. In addition to that, the senior health environmental officer would have explained to them how to dispose of their garbage, and work with them to find an area next to the community there where they can dispose of their garbage. We also work with them to find a suitable area where they can set up toilets and so forth, so that they're not defecating in the same water that they're using to drink. So all of this was done on Sunday, and hopefully by putting these measures in place, we'll start seeing a reduction in the cases of diarrheal diseases, and hopefully, once they start taking certain precautions, you will see less cases of acute respiratory infections and so forth. We have also made arrangements to get a number of hammock nets for them. So during this week, we'll probably get about 50 or so hammock nets that we'll send into the community. This would certainly help, because if they sleep under these nets, then it's going to protect them from mosquitoes. And we have made an arrangement with a few of the persons in the community who would act as liaison with the regional officials and with the Port Kaituma Hospital. So once that is done, I think whatever issues they're having in the community can be directly communicated with the health authorities, who would be able to take the relevant measures. So I think by and large, the interventions that we made were very timely, because it would certainly help the community to get better health care.
I have some questions from Nightly News, and this really turns our attention to COVID-19 and our campaign. They're asking if the third dose, the booster shot, for any of the vaccines is a repeat of the first dose. Minister Anthony further provided information of the vaccines available for the booster shot.
Now, in terms of the vaccines that we have administered in Guyana, we have done Pfizer. We have done a limited amount, less than 1,000 doses of Moderna. We did AstraZeneca, we did J&J, we did Sputnik V, and we had Sinopharm. So when we look at the spectrum of vaccines that we give, if you got 2 doses of Pfizer, then we're recommending that if you're doing a booster, that you get a Pfizer as your booster. If you had Moderna and Moderna, you can either do another Moderna as your booster, but right now we don't have that. But there's nothing wrong if you want to get a Pfizer as your booster. With Johnson & Johnson, if you took a Johnson & Johnson vaccine, then after 52 days after, you can get a booster. With Sinopharm, if you had 2 doses of Sinopharm, then your booster should be a Sinopharm vaccine taken 3 to 6 months after your second dose. If you did AstraZeneca, so you had 2 doses of AstraZeneca, then your third dose, you can either opt to get AstraZeneca again, or you can use an mRNA vaccine, which would be Pfizer. So 6 months after your second dose of AstraZeneca, you can get mRNA or a Pfizer vaccine to complement your AstraZeneca. If you took Sputnik V and you completed both doses, then you can take a J&J vaccine, and that would complement the series. So you can use the J&J as a booster. So this is the regimen that we'll be using. So anyone who want to get their booster can come to any one of our facilities and ask for the booster. We'll require you to bring your vaccination card so that they can write the dosage into the card.
To date, almost 400,000 persons have received a first dose of a COVID-19 vaccine.
As of yesterday, we've had 396,042 persons who receive a first dose of a COVID-19 vaccine. That's about 77.2% of our adult population. We've also had 269,791 persons who receive a second dose. That's now 52.6% of our adult population. In terms of persons 12 to 17 years of age, first dose, we are now at 28,709, and second dose, 19,905. So for first dose, that would be about 39.4% of our this age cohort of 12 to 17, and the 19,905 would be approximately 27.3%.
That's it for today's COVID-19 update. For more information, visit our website dpi.gov.gy or health.gov.gy and our social media platforms.